name is Barry Brogan, and I want to welcome you to the North Country Behavioral Healthcare Network's Frontline Voice series, focusing on the people and the services that are supporting the North Country during the COVID-19 pandemic. Today we are speaking with Christine, or Chris, Henderson, who is a registered professional nurse and nurse supervisor at the Credo Community Center for the Treatment of Addictions, located at 595 Main Street in Watertown, New York. Chris works in the Opioid Treatment Program at Credo. Welcome, Chris. Please tell us a little bit about the Credo Community Center and about the work that you do there.
Barry, thank you so much for having me. I appreciate this opportunity. I am currently, as you said, the nursing supervisor in what we call the OTP clinic, which is the Opioid Treatment Program. It's a fairly new clinic here. It started almost 4 years ago. And it's the only one between here and between Syracuse and Plattsburgh, and very much needed in the Watertown area. So what we provide primarily is medication-assisted therapy to people who are struggling with opioid addiction, either prescription opioids, heroin addiction. So we do not only medication-assisted therapy here in the clinic, we have a wide variety of other assets here to help our clients, because as we know, it's so much more than just taking a medication. So we treat our clients here. We have peer advocates. We have care management who helps with everything from transportation to making sure clients have food to eat, housing issues, any of those details. We of course have clinicians, groups, psychiatric nurse practitioners, our medical director. So we have quite the full scale of people helping out here.
Yes. Chris, can you tell us a little bit about your observations about how the job has changed, either for you particularly at the OPT or OTP?
A common mistake.
Or within the vast array of services that Credo offers, the changes that have been brought on or that you've noticed as a result of the COVID-19 restrictions.
Right. Right. Actually, the restrictions have impacted our services quite dramatically, and they've really impacted our clients. So previously, as nurses here, most of our clients come in and dose 6 days a week. So we would see our clients 6 days a week to give them their medication, spend a few minutes with them. How are you doing? And if clients came in crisis, which they often do, because many areas of their life is in chaos, especially in the beginning when they're just starting to recover, we had a full complement of staff here on site. All those people I listed before, from the peer advocates, managers, clinicians, care management, medical people. And so if a client came to us to dose and was in crisis, we could take a few minutes, assess what they needed, and give them an immediate face-to-face handoff to the person that could help them in that moment. Since COVID and all the restrictions that have been put in place, the vast majority of our staff are working hard remotely from home. And I'm so impressed with them because they have absolutely embraced some new technology that they were unfamiliar with in an effort to just keep contact with our clients and continue doing individual sessions, even group sessions. We now are able to do group sessions with our clients from home. So one of the things I find that has been difficult for our clients is that when they do come in now to dose, and they're in some type of crisis, they do see the nurses still every day, which is really important. But we have to assess them, send them away, make sure we have a good contact number from them, find the person that they need, and then have that person reach out to them. And sometimes that's a real barrier for our clients. They don't all have working phones. Perhaps by the time someone reaches out to them, they don't want to talk about that crisis anymore. Work can be done in that moment of crisis when they're vulnerable and wanting help, and a lot can change a few hours or a few days later. So that's probably been one of the hardest things that we have struggled with here, is working to keep our clients connected.
Well, Chris, you use the word connected, and I was just heading that way. You mentioned that some folks don't necessarily have cell phones or have telephone contact. When the other staff that's been doing this remote work, have they run into issues with access to connectivity on the part of clients or patients, or even potentially the clinician themselves may not have great connectivity? We live in the vast North Country, and not everybody has good wideband internet. So has there been connectivity issues that Credo's had to deal with?
Actually, our staff, as I said, have just been wonderful. Credo has gone above and beyond to make sure that the staff have work cell phones that they can use specifically to speak with their clients. I think the bigger barrier is when the clients don't answer the phone, when they don't have a phone, when they have to find a friend whose phone they can borrow. They're living in a hotel and don't have a phone, and the hotel manager perhaps isn't helpful with getting a message to them, or they're going from house to house because they're homeless. So that actually has been the biggest barrier. And really, that's where the day-to-day contact with the little staff that is here. We have a staff of nurses, engagement staff, and a manager on call. And so every day we get a report of clients that clinicians are having trouble getting a hold of. And so when they come in to dose, we try to strategize, assess what's the barrier, what can we do to help you. We try to make a plan for them and then get that information to their clinician so that we can break that down and get in touch with that client.
Okay, great. So I just have, I think, 2 or 3 more questions. I want to make sure that our audience has a chance to understand. So you've mentioned this Medicaid assisted therapy or treatment, I've heard it called, and you talk about people coming in and dosing. Some of us may not understand why folks who are trying to beat an addiction are being provided medications or drugs. Can you talk to us a little bit about the science behind medication-assisted treatment?
Absolutely. And I'm glad that you asked that question. There is so much stigma around what is commonly called a methadone clinic or medication-assisted therapy. There's also a grand misunderstanding among the general population of how this works. So the way that this works is that when someone has been addicted for a long time, the opioid receptors in the brain have actually been altered and will not go back on their own to what they were before this client was addicted. So in the meantime, when they're not taking any medication to help with this, they're experiencing extreme cravings. They have difficulty thinking clearly. They can't begin the behavioral health aspect of it in this state of mind. There's also a syndrome called PAWS, which many of our clients have, which is post-abstinence withdrawal syndrome. And that's long after they have quit using. They still experience withdrawal symptoms. And the most significant one of those is serious cravings, along with difficulty sleeping and difficulty thinking clearly. So when you can fill those opioid receptors, the client can then begin to work on the other aspects of their life. Some of them stay on it for a very long time. Some of them use it as a temporary tool until they have been able to do the counseling that's needed and the various therapies that's needed to help them get their life back together.
Chris, thank you. That's so very helpful to better understand that part of behavioral health care. So thank you for that. So just, again, a couple more questions. Tell us a little bit, again, we're trying to focus on the work of behavioral health care providers and the recognition that they provide such a very important part of the overall healthcare continuum. What, as a registered professional nurse, what drew you to this line of healthcare, which is very unique from the medical side? Although you're doing medical too, obviously, but
you know what? It is very unique to nursing. When I went to nursing school many years ago, I think that addiction was just a couple pages in the psychiatric unit, and it was hardly touched upon and very poorly understood at that time. So actually, many years ago in the 90s, I had an opportunity, a wonderful opportunity to work in a detox and inpatient facility in central New York. And while I was working there, I discovered that I loved working with addiction. I was able to see the human being beneath the addictive behavior. I was able to see that it affected all walks of life. It couldn't be anyone's mother, anyone's brother, anyone's child. No one is immune to it in our community. And I began to see stories of incredible recovery. Clients who I didn't believe were going to make it made it, and I didn't ever know when that was going to happen. And to watch them transform their lives from such despair that affected everyone around them, not just them, but to watch them do that hard work and begin to piece their life back together and become healthy again and become a member of society again was so impressive to me. Watching them do such hard work with a disease that is a lifelong disease, and it takes a lot of work. And so I grew to love working in the addiction field, and I was very happy when this clinic opened up here and was excited to get in as it began.
Wonderful. Well, Chris Henderson from Credo Community Center, thank you so much. We always end with an opportunity for you to tell our audience, how do they get in touch with Credo Community Center if they want to reach out for help?
Absolutely. I'm happy that you asked that. First, I want to say to anyone out there who is looking for help, we are open. We are still providing services. They may look a little differently than they did a couple months ago, but we are absolutely still open. You can call our main number, which is 315-788-1530, and someone will get in touch with you. They will answer the telephone during normal working business hours. We do have engagement staff here to help anyone who calls. We are also taking new clients into our clinic, so we are not closed, we are not shut down, and we are not on pause. We are definitely moving forward to help tackle this opioid epidemic, which does not rest just because there is a pandemic. And
Chris, one more time, let's give out that telephone number.
Sure, it's 315-788-1530.
Great, thank you so much. Chris Henderson from Credo Community Center, thank you so much for being part of the Frontline Voices series, and thank you for sharing your thoughts. This is Barry Brogan with the Frontline Voices series. Thank you.